So what is rhinitis medicamentosa? Rhinitis medicamentosa is also known as Rebond nasal congestion, commonly associated with overuse of over-the-counter nasal decongestants.
You know, I'm addicted to nasal spray. I smell everything! I'm invincible! I'm probably going to be a little down until I use the spray again.
Essentially, what happens when you use this spray is they cause sudden and dramatic changes in blood flow to the lining of your nose. This causes the lining of your nose to shrink back, opening the nasal passages and make it suddenly easier to breathe through the nose. This can be fantastic in the short term, if you have a cold, severe allergies, or another reason that the lining of your nose is swollen. However, once you use them for more than 10 days, they cause unhelpful changes in the lining of your nose. Although they still cause the lining to shrink back when first used, this effect lasts for shorter and shorter periods of time. In addition, when they wear off, the lining becomes more and more swollen. This is thought to be due to a combination of more blood coming back into the nose or the rebound hypervascularity and swelling of the tissues between the blood vessels or the tissue edema. The combination of this effect is what is known as the rebound nasal congestion or the rhinitis medicamentosa. The end result is a nose that is more and more black, that often starts to feel painful or irritated, and you may start having small volume of nosebleeds. The only thing that fixes the blockage is the sprays that causes the problem in the first place. Effectively, think about it as your nose being addicted to the spray despite the harm that it's causing. Okay, so let's go to the symptoms of rhinitis medicamentosa. So unlike hay fever, or what we know as the allergic rhinitis, that is caused by allergic reaction to pollen, typically when it comes into contact with our mouth, nose, eyes, and even with our throat. So rhinitis medicamentosa usually doesn't include this itchy eyes, itchy nose, or itchy throat among its symptoms. Congestion is usually the only symptom that occurs with this problem. So the kind of congestion is persistent and occurs without any allergic triggers and worsening with increasing nasal spray frequency and dosage. So what causes this rebound congestion? There are two important parts of your decongestant sprays that can cause rhinitis medicamentosa. First one is the active ingredient. This stimulates naturally occurring hormonal receptors in your nose to cause blood vessels to constrict. This shrinks back the lining of the nose and makes it easier to breathe. With repeated use, there is a decrease in the number of these receptors and a change in the structure of the lining of the nose, which makes the spray less effective and the nose more congested. The second one is the benzalkonium chloride. It is commonly used as preservative in nasal sprays and is present in many nasal decongestants. It's there because it stops the bacteria in your nose breathing in your spray bottle after you use it. It's been shown that in combination with the above agents, that rhinitis medicamentosa will occur after a much shorter period of exposure, and the benzalkonium itself can lead to damage to the nasal lining if used for a prolonged period of time. So what should I use to decrease inflammation and swelling in the nose? This period can be made less uncomfortable by using medications using this time period that decrease inflammation and swelling in the nose. This can include saline rinsing or hypertonic saline, topical steroid sprays such as Mucinex, Rhinocort, etc. Use at the maximum dose advised for about 2 to 3 weeks when you stop your decongestant sprays. And the third one is the oral steroid, such as cortisone, prednisolone, that needs to be prescribed by doctors, and oral decongestants that are available over the counter. But as a reminder, it is important to take them as exactly prescribed by your doctors.
One purchase at a drugstore that can lead to years of misery. We're talking about over-the-counter nasal spray. When used correctly, it can bring relief from a stuffy nose.
Our senior health correspondent, Monica Robbins, found if warnings aren't heeded, users can easily get hooked on these, leading to a lifetime of dependence and, in some cases, permanent damage.
Brian Dahl can't live without it.
People sometimes think I'm a cocaine user because I sniff so much, you know?
Dahl's drug is legal and available at any drugstore over the counter.
I've got one in my book bag that I carry around. I probably got one in my car. I probably got one upstairs in my bedroom.
A stash of nasal spray, never far from sight, that's allowed him to breathe freely through his nose for 2 decades. Adrian Matthias, too.
I had to have it in my drawer, at my house, in my car, anywhere I went, I had to have it.
A nagging cold started her nasal spray addiction.
But then the cold went away, and I still couldn't breathe. And I couldn't breathe without it, and then it became obsessive.
Matthias and Dahl are far from alone. Sales of non-prescription nasal sprays top $45 billion with generic label, Afrin No Drip, and Afrin leading the pack. And the warning labels are there for a reason.
This is a true addiction. It is a psychological and a physical dependence on this, so it can be a real challenge to get off of these sprays once you've been on them for a prolonged period of time.
Too often, Dr. Raj Sindwani sees patients who can't stop the spray.
Over time, they stop working and actually cause rebound swelling, putting you even further behind than when you were when you started taking them.
So when should you take them and for how long? The sprays work for severe congestion, like from a sinus infection or cold. But as the box clearly states, no more than 2 doses a day and no longer than 3 to 5 days. Warnings Dahl and Matthias wish they followed.
If I stopped using it, then it would just, inside just swell up and, couldn't breathe.
When you can't breathe, you panic. And that's what makes it so scary.
To break the cycle, doctors will usually switch a patient to steroid nasal spray. They're non-addicting and can be used long-term. For tougher cases, steroids in a pill. Matthias kicked the habit on her own. Dahl is still struggling.
The longer you use it, like for me, years and years and years, it's almost like your nose, it's like it remembers.
Okay, so let's talk about the video. As we seen in the video, overuse of the nasal sprays is the reason of Rhinitis Medicamentosa. The users of nasal decongestant should be mindful on how to properly use it and what are the possible side effects that might happen when they use them for more than the prescribed duration. Being dependent on it can be harmful than giving us relief. Yes, we can be relieved for a short period of time, but we can struggle for a much longer time due to congestion. We can see how difficult it is to stop using it when they already used to do it on their daily routine. Lastly, for the nursing responsibility, first is we need to teach the patient the proper administration of the drug to ensure the therapeutic effect. Second, the patient should be instructed to clear the nasal passages before use, to tilt the head back when applying the drops or sprays, and to keep it tilted back for a few seconds after administration. And for the third one, caution the patient not to use the drug for longer than 5 days or the prescribed duration, and to seek medical care if signs and symptoms persist. And lastly, provide thorough patient teaching, including the drug name and prescribed dosage, measures to help avoid adverse effects.